Okay, hello everyone, this is Mikva Clinic. Today I will provide you with the necessary advices that you need to know while taking patient history or while clerking a patient. So, one thing that you should know is taking patient history needs both physical and mental preparation. Physically, you need to be prepared by keeping your grooming, you have to keep your gown clean, and that you have to be equipped with the necessary materials which are important for doing those physical examinations. So once you are physically prepared, you need also to be mentally prepared, so that you need to be equipped with the knowledge of at least the structure of the history taking. The other thing is you should be in a good mood condition so that that mood can easily project to the patient. If you are in a bad mood, then that can also project to the patient. So while before facing to the patient, as much as possible try to create a good mood for yourself. So once you are mentally and physically prepared, then you will go to the hospital where the patient is found. So before starting to clerking, always you have to know that as much as possible, always this condition might not be fulfilled, but if possible, try to have a quiet, comfortable, well illuminated, well ventilated room. So this will create a comfortable environment for the patient so that he can easily or freely provide you with adequate information about his illness. Always you have to show the patient smiling face. When you initially encounter the patient, try to show him smiling face. So by looking at your happy face, then the patient will develop a confidence on you. And the other thing is, it is also the time where the patient healing starts. Always try to have a smiling face when you first encounter the patient. The other important thing that you need to know is you have to avoid any unnecessary observers from the environment. Those observers can be attendants, they can be patients, or they can be other hospital staffs. As much as possible, we need to remove or avoid those observers which create discomfort on the patient. The other thing is we need also to avoid unnecessary interruptions from the physician also. So as much as possible, we need to make our phone silent if possible, and we shouldn't respond to any phone call while the patient is speaking, or at least we need to apologize the patient before responding to a phone call. Once we create this environment, the first thing what we do when we get the patient is we need to greet the patient. After greeting the patient, then we need to introduce ourselves. You have to tell the patient if you are a physician or if you are a medical student, so you have to introduce yourself in detail to the patient, so the patient will become aware of your status, and based on that he will provide you with different informations that you need. So after doing all these things, we'll proceed with history taking. The most important mistakes that especially new medical students or new nursing students, new clinical pharmacy students, in general anyone who started clinical clerkship, the common mistake that we make is we ask the patient history by following the structures of the history. So this is wrong. For example, you may start with asking his name, following with his age, sex, occupation status, marital status, date of admission, and the like. Then you proceed with previous admission, then chief complaint. But what we should do is always we should start with the most concerning thing for the patient, that is the chief complaint. So we should first initially ask, what is the main reason you came to here? So the patient will start to explain the details of his illness. He will tell us the natural course of the disease, starting from the beginning to the end. So this is the first question that we need to ask to the patient. After asking this, the patient will start speaking. Once he starts speaking, we shouldn't intervene or we shouldn't interrupt him. Rather, we need to be a good listener. And while listening, what's expected from us is one thing is we should maintain always eye contact with the patient. If we are able to maintain that eye contact, so the patient will know that we providing all of our attention to him. The other important thing is the note taking. Note taking is by itself good. It's a good skill. It's a good thing, but always we need to avoid that note taking while the patient is speaking. As much as possible, we have to summarize the patient's report after the patient finished his speaking. So this is the most important thing, that we need to be cautious while listening to the patient. The other thing is the patient in between or in the meantime, we may need to ask additional questions for the patient. So we use two types of questions. One is open-ended question, or that is what we call it indirect question, and the other thing is close-ended or direct questions. Open-ended question is the one which we asked him initially, like, what is the main reason that you came to here? Can you tell me your childhood history? Or can you tell me about your vaccination history? This is open-ended question. On the other hand, close-ended questions are like, for example, yes or no questions. Do you have cough? Do you have shortness of breath? Do you have chest pain? Do you have abdominal pain? Do you have pain during urination? All these questions are close-ended questions. The preferred one is open-ended questions, because patients with open-ended questions will have a freedom to explore all the informations in their mind. That will give them the freedom to tell you the details of their information. So the preferred one is open-ended questions. But in some conditions, if you are obliged to ask close-ended questions, so we may use close-ended questions. The other thing while listening to the patient, we shouldn't use medical terms, because medical terms may confuse the patient. This is because medical terms may create confusion on the patient. Even sometimes patients may use medical terms because they get different information from different social medias. They may Google different information. They may get different information from different relatives. Based on those informations, they may use wrong words for wrong interpretation. For example, patient may say he has dyspnea, but he may not know the meaning of dyspnea, or he said dyspnea because considering dyspnea as a chest pain. So in this time, we need to clarify to the patient, do you mean that you have shortness of breath? So if the patient says yes, that means he understands the word or the meaning of that medical term. If he says no, that means he said dyspnea because he didn't have a complete information about the meaning of that medical term. So always we need to clarify, even the patient uses medical words. If we know these basic informations on taking patient history, you may encounter different types of patients, which means patients have different behaviors. So we need to treat those patients based on their behaviors. So based on this behavior, one of the type of patient is, we call it garrulous patients. Garrulous patients are, they will waste your time because they will provide with unnecessary a lot of extra informations, and those information doesn't have medical relevance. So they will waste your time. In this time, we may need to narrow, or we may need to ask them close-ended questions. For example, if one patient came to my office and he presented with cough of 1 week duration, so I asked him to elaborate the details of the cough. So I started with explaining that, yeah, I have a dry cough which started last week. Yeah, I remember last week because last week Sunday it was the ceremony of it was my son's wedding ceremony. By the way, he's a very nice guy. His behavior is very good. He's intelligent. He's graduated from medical school 5 years back, and almost all of our relatives loves him. So this patient is providing you with information which is not relevant for you. So he is wasting your time and his time. What should we do is we need to ask him closing-ended questions. We have to interrupt him and we will ask him. So you have cough of 1 week duration. Tell me the details about the cough. What the cough is productive? Do you have any additional associated symptoms and the like? So you need to ask him more of a close-ended questions for these garrulous patients. It's common to encounter these types of patients. The other types of patient is angry patients. Patients may become angry because of different situations in the hospital. They might be angry because of the health facilities. They might get angry because late opening of OPD. They might get angry because of repeated clerking or by different medical students and physicians. They might get angry because of their previous treatment. So due to these different conditions, the patient initially may present you being angry. So what's expected from us is we need to cool down that patient. As a physician, we need to apologize the patient on the behalf of the institution if the problem is from the institution. If the problem is from the physician, then you have to apologize and then you can create a good harmonious relation with the patient. If you are a medical student, especially when patients know that you are a medical student, so that you are using them for learning purpose, they might get angry to provide you with their history, and even they might not be willing to for the physical examination. So what is expected from you is a wise approach. You need to be confident and you need to introduce yourself, and you need, as much as possible, you need to know what you are doing. Once you show them these things, then you will get their trust. Then you can proceed with your clerking. So these are what we call them angry patients. The third one is well-informed patients. This is good because previously it was thought that the doctor knows better than the patient. But nowadays it's accepted that both the doctors and the patient should be involved with the diagnosis and management of the patient. Well-informed patients will gather different information about their illness from different medias, from different peoples, and through different reading. It is good that they gather this information. However, this condition may lead to or may decrease their attentions for your questions, for your information, for your advice, and they may refuse your investigations, they may refuse your diagnosis and treatment. So it will create this problem. What's expected from the physician for a well-informed patient is we need to show them what is relevant and what is irrelevant. Based on that, they can expand or they can increase their knowledge on their illness. These are the types of patients that we encounter when we try to clerk a patient. If you know this much about the patients, you may also encounter different behaviors from their attendants, because most of the patients, especially admitted to the ward, those which are in the ICU, or those critical patients at emergency OPD, usually they will have attendant or accompanying person. That attendant may have his own behavior, so you have to treat those attendants based on their behavior. The other thing is sometimes patients may not want the attendants to be around while taking the history because of the confidentiality issue. They may not provide you with the information that you need while the attendant is there. So in this scenario, you should ask the attendant to leave till you finish your clerking. And on the other hand, sometimes the patient even may want the attendant to be with them, so that even the attendant may provide you with additional information that the patient can't, because sometimes patient might get exhausted and patient might be in coma or some patients can be critical, so they may not provide you with the information. In this time, the attendant may provide you with enough information. The other thing is attendants even may help us as a language translator, because people, especially if you are working in large setups, so like tertiary hospitals, patients from different parts of the country may come to that health facility, so you may not access, or you may not have you may not able to communicate with all languages coming from different districts of the country, so the attendant may help you to translate those things. So these are the benefits of the attendants. The other thing is sometimes patients may not want, or they may not want to disclose their diagnosis to their attendants, which usually the attendants are the family. So always we have to keep the interest of the patient. Whenever we disclose some information to other person, it should be based on the consent of the patient. These are the things that we need to be aware of concerning about the attendants or the accompanying person. So once I take history based on these things, then I will reach on analysis of the patient's history or the patient's symptoms. So how do I analyze the patient's symptoms? Yeah, there are two things we use for analysis of patient symptoms. As a new medical student, or as a new nursing student, or as a new health officer student, as a new clinical pharmacy student, when you clerk a patient, then you gather some symptoms from the patient. Then the combination of that symptoms will give you certain diagnosis. So analyzing of those symptoms depends on the factors that we read from the textbooks. But as an experienced physician, the analysis will be depends on the physician experience plus the updated reading of textbooks. So our analysis skill will be on a continuous should be in a continuous increment, and it will increase through experience, which means through a continuous clerking of a patient and through a continuous reading of updated information. So during analysis, there are some principles that we need to know. One is the hard-soft symptom principles. Hard-soft symptom principle is simply soft symptoms are usually symptoms which are common almost to all disease conditions. The hard symptom is the symptoms that we need to give emphasis. For example, a patient presented with abdominal mass, and associated with abdominal mass, he has abdominal pain, he has nausea, loss of appetite, and weight loss. So from all these symptoms, the hard symptoms, or the symptoms that you need to give emphasis is the abdominal mass, because it will lead you to specific diagnosis. But if you give special attention to loss of appetite, or if you give special to nausea, it is almost a common symptom for most of the disease. So this is what we call them soft symptoms. So we need to use this hard soft symptom principle while analyzing the symptoms. The other thing is the time course of the disease. The time course of the disease is always when we mention the symptom, we know the anatomy. For example, if I say cough, it's the anatomy, which means the problem arises from the respiratory systems. And if I say urinary frequency, the problem is on the urinary tract. So the symptom will tell you the anatomy. On the other hand, the time will tell you the pathology, which means the time means whether the disease is acute or chronic. For example, as I mentioned, cough of 1 week duration. So I will consider more of infection, or it can be from embolism, so occlusion of the pulmonary vasculatures. On the other hand, if the cough stays more than 1 year, then the pathology might be more of from serious things like lung cancer, or like chronic obstructive lung disease, or asthma, the like. So the timing will tell us the pathology, whether it's acute or chronic, because there are, for acute disease conditions, there are differential diagnoses. For chronic dysfunction, there are differential diagnoses. So by analyzing the time course of the disease, then this will help us on the analysis of the symptoms. So these are the principles that we need to know while analyzing symptoms. So once I analyze the symptoms, then I will reach to the diagnosis. Yes. So there are two ways of reaching to the diagnosis. The first one is pattern recognition. The second one is logical analysis. Logical analysis is the one which I have mentioned earlier. Through analyzing of all those symptoms, then I can reach to the diagnosis. So my skill of analysis of those symptoms depends on my reading and depends on my experience. On the other hand, when I come to pattern recognition, usually the pattern recognition is used by dermatologists. By looking at the pattern of the skin lesions and the distribution of those skin lesions, dermatologists usually differentiate one skin disease from the other one. After analyzing a patient's symptom, then we will develop or we will construct our differential diagnosis. The skill of developing differential diagnosis depends on our reading and also experience. So through a continuous clerking of a patient and through a detailed reading, we can be equipped with the skill of developing lists of differential diagnoses and the skills of narrowing those differential diagnoses and finally reaching to the diagnosis. So these skills is developed through reading and experience. Always when we try to analyze the patient's symptom, then we need to use the principles, what we call it Occam's razor principle. This principle says that we need to attribute the constellation of those symptoms to specific diagnosis, rather than considering a lot of diagnosis for a single patient. It's better to attribute those symptoms to specific diagnosis. But this is not always true, because patient may come with one or more diagnosis, especially elderly patients usually have more than one illness. So different symptoms might be attributed to different disease conditions. The skill of this, what we call it multiple causation diagnosis, is usually it is applied by experienced physicians, usually seniors, consider additional diagnosis. But as a junior physician, as a new medical student, always we need to attribute the constellation of those symptoms to certain diagnosis. But there might be scenarios that when we consider, we might attribute one symptom for one diagnosis, the other group of symptoms to certain diagnosis. But this skill is developed through a continuous, through experience in general. Finally, after writing our history, we need to put the summary of the history. Summary of the history contains the pertinent information about the patient. This is relevant one for us to summarize, to have the gross knowledge about the patient. So in general, the summary contains the age of the patient, the sex, and the presenting symptoms. He is 30 years old male patient, presented with cough of 1 week duration, shortness of breath of 1 day duration, chest pain of 3-hour duration. So you will list the presenting symptom of the patient, so that when the senior or other physician listen to your summary, can easily have the overview of the patient. So always at the end of the history and physical examination, we need to have the summary of the two. So we need to summarize the history. This is because we can easily report to other physicians. We can easily report during our round or bedside session. So we need to know these important things while writing history.